I want to bring in our chief medical correspondent and, of course, a board-certified OBGYN, Dr. Jen Ashton, tracking this with us here this morning. And again, Jen, you know I always ask these questions. What's the bottom line for women watching at home this morning? What are their options, and where does that stand in the country right now if this is a situation that you're facing or you fear you could face at some point in the future?
Well, first of all, David, I think not only board-certified OBGYNs, but certified nurse midwives and nurse practitioners and physicians' assistants, everyone in the medical profession who has dedicated their lives to taking care of women, are concerned. But we remain committed medically to providing safe reproductive health care to women. And I want to be clear, this is not just a women's health issue. This affects men in these women's lives, their fathers, their sons, their partners. And reproductive health is not just women's health, it's human health. So I think that what's important right now for women to know is, there will always be options, medical options, surgical options. The key is protecting two lives when a woman is pregnant, not just the life of the woman and the mother carrying that fetus, but the fetus as well. And there are medical conditions that literally put both of those lives at stake. Obviously, there are a plethora of other issues involved when we talk about abortion, but medically, this is literally oftentimes a life or death issue. And I think that the healthcare professionals who were there yesterday will be there today and tomorrow to help these women.
And if you're a woman in one of these 13 states with a trigger law, Dr. Jen, that goes into effect almost immediately banning abortion, what are the options medically?
Well, first of all, it's not one size fits all, David. It depends on the health of that woman. It depends on the gestational age, how far along she is in that pregnancy, which oftentimes is difficult to ascertain. Medication abortions are FDA approved up until 10 weeks, that's 70 days. Again, that's not always a fact that can be known for sure. And there are options to prevent unintended pregnancy. Most people confuse the two, that so-called Plan B, which people may have heard of as the morning after pill. That does not cause a termination or an abortion. That is taken after intercourse to prevent an unintended or undesired pregnancy. It's not 100% effective, but usually it's in the high 90s. The earlier it's taken, the better. Then when you talk about options for medication abortions, this will terminate a pregnancy and cause the evacuation of any contents of the uterus. These are given usually orally with two medications that are FDA approved, and again, up until about 10 weeks. So time is not always on the side of the woman from a medical standpoint. Oftentimes, in cases of a fetal anomaly, that's not diagnosed until 21 or 22 weeks. So that's where you get that 1% of abortions occurring after 21 weeks, oftentimes because it's not diagnosed before then. It is important to remember also, David, that over 90% of pregnancies of abortions occur in the first trimester. So that's really when time matters.
Dr. Jen Ashton, we really appreciate your insight here this morning, board-certified OBGYN, and of course our chief medical correspondent, on reaction within the medical community that will have to react swiftly because of the impact this is having on what perhaps they might be able to or not be able to do in some of these states moving forward. Dr. Jen, our thanks to you.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.